My name is P.A. Clarke, and we are doing some threads today. We have Melissa. Melissa, you've had some treatments before, but nothing major. A little bit of Dysport, a little bit of filler here and there, but nothing major.
Yes.
Today, we're kind of getting a little more into the non-surgical facelift. What is bothering you more?
So my jawline.
The jawline.
Yes.
So a little more fullness you're noticing?
Yes.
Or the loss of that angle you normally had?
More of a sagging.
More of a sagging.
Yeah, I feel gravity
I
kicking
see.
in.
Let's look down slightly. So yes. So when you do your selfies, if you're looking down, sometimes you kind of see the jaw falling a little bit more, a little more shadow.
Yes.
Yeah.
Yes.
Yeah. Okay. Very good.
It's actually candid. It's not selfies. It's the candids that get you.
It's the candid.
It's
Okay.
to get you.
And what is happening is there's a fat pad in the face. So there are fat pads all around the face. And those fat pads gives us volume and shape. As we age, the shape of the fat pads change and sometimes slide downward or become flatter. And what happens is the fat pad that generally will be around this region tends to fall along here, causing this to push out slightly. And that's where we get the jowls and everything from. But this is also coming from ligaments and muscles and the loss of bony tissue. But to keep it simple, let's just talk about the fat pads. The fat pads really change in shape, and so that's why the face changes in shape as we age. So what we're going to do with the threads, we use the threads to kind of really pull up. So if you ever want to see what threads are going to do, don't do this. That is not a good representation of what threads will do for you, and don't allow anyone to tell you this is what I'm going to do for you. That doesn't happen. You want to take all 4 fingers and put it along the cheeks and pull up with all 4 fingers, and that gives you a better representation of what the threads are going to do. So you go here, 4 fingers up, not 1 finger, because nothing does that. Okay, very good. So that's just one simple example of what the threads do. The threads also connects not only to the fat, but it also connects to the fat, which connects to the skin, so the skin changes in terms of height. So threads will give some pudding, some traction to the skin, and what that does, it helps the skin heal tighter.
Because I do remember, I do want to say that Clarke has been discussing this with me for about 9 months, 10 months?
Under a year.
Yes. Under a year, he's been patient and kind and giving me space to talk and explore this. As the months are going by and I'm aging, and I'm 43 and I have 2 little ones, and I don't really take time to look at myself, but the candids were coming in fast with the kids as they're growing up, all the photos that I am in with my children, and I came to you and I felt I looked a lot older than I felt inside, and I wanted to be a reflection of how I felt, and especially in my kids' photos. So I want to say thank you, because he's educated me on this for 9 or 10 months, and we're here today.
And we're here today.
And you did teach me that there's collagen that goes around the thread. Is that correct?
That's right. It's called fibrotic tissue.
Yeah.
Very good. You remember that. So threads is something that not only creates physical traction, but it also allows your body to heal around the thread, creating tissue that keeps the lift up, and that's why it can last 2+ years. Depending on how it's done, you may even get 3 years out of it. I've had patients from many years back that still look pretty good. So threads have to do with who's doing the procedure and not just the threads. Always remember, do not be afraid of the procedures, be afraid of who's touching your face.
Question it. Ask lots of questions, right?
Ask
Be
a lot of
curious.
questions,
Be curious.
and make sure that the answers come out easy. It shouldn't be, well, maybe because of this or that, or I think. It should be direct and confident. But I'm glad you're taking back control of your features, of your visual self, of your visual aging. Visual aging sometimes is deceptive. You feel great inside. You're doing your parkour. You still do parkour?
No.
You're doing your parkour, and you look great. You know, you feel great, but you look in the mirror and you don't feel like you're representing yourself.
That's the irony of life. Once you start to get into your own skin and know who you are, sometimes life leaves its marks on you, and
Yes.
sometimes you're just at a certain age. And thankfully, with technology and wonderful people like Clarke and Carol, you in Diamond Works,
Yeah.
Med Spa,
Yeah.
you
Yeah.
feel like I have a chance at this. Like
Yeah.
I have a
Yeah.
chance of
Yeah.
reflecting what's inside on the outside. So I greatly appreciate that.
You're welcome. Thank you so
Greatly
much.
appreciate it.
All right, on that note, we're going to dive into the actual consultation really briefly,
Okay.
and then we'll jump into the treatment. Treatment typically lasts about 30 minutes or less. My techniques are generally different than whatever you see on YouTube or wherever you go. I do incorporate a lot of new techniques that I will be teaching at some point, but anyhow. So let's look here. So this is what my most interest is in. I want to relocate this back up here. So in order to do that, I have to have a thick enough thread and at the right angle to not only pull in this direction, but to also pull in this direction. So what's actually going to happen is I'll make the face appear slightly thinner just because I'm taking the fat off of this bone, relocating it above the bone so that you have a more slender result. Now, many times you'll see that result immediately. Sometimes if there is a little bit of swelling, you may not see the full result. And this is why we'll do an after about 1 month or 6 weeks after, so we can have those results. Okay. So threads come in many different shapes, sizes, and forms. And the company I'm using is Clarke. Great company. They've been around for, I think, over a decade, if I'm not mistaken, but they have really transformed the way I do threads. And I think they're very comfortable for the patients, and patients actually have less downtime based upon the technique and also the ability for the thread to glide easily through the tissue, creating less trauma.
Wow.
If the technique, and sometimes you see YouTube videos with really harsh techniques, if the technique is harsh, your downtime is even longer. So the easier the procedure, the quicker the downtime and the more comfort you're going to feel. So you must be careful who is doing your treatments rather than having it done. And the supplies. So these are the threads, and this is the Clarke thread. It's 19 gauge, 100 millimeters, which is the correct size and shape for what I want to have done. Very good. I will open just to show you what the threads look like. Everything is under very clean technique, not sterile, because once you open anything to the environment, it's not sterile anymore. So even though nothing has touched anything, we still can't say sterile. In the package it's sterile, but once you open the package, it's not sterile anymore. So this is what the thread looks like. It comes in a protective sleeve. Once that sleeve comes off, then this is the thread. I don't know if you can see closely, but this is what it looks like. 19 gauge. Very good.
How many gauges does it come in?
So there are about 5 or 6 different gauges, and there are about maybe 3 gauges that matter.
Okay. And that allows you to have a custom
Absolutely.
customization.
So some patients may want an 18 gauge, which is a very thick thread.
Okay.
Others may want a 23 gauge. I like to use a 23 gauge sometimes, but it's not always available depending on the company.
Okay. And that, when you say the gauges allow for more pull or more?
Both.
Okay.
The thickness, which is the gauge,
Okay.
allows for better grip on the tissue. If there's a lot more tissue, you need a lot more grip.
Okay.
That's a great question, and if I can expand on that question.
Okay.
So threads are made of something called PDO, polydioxanone. What that is are sutures. They're surgical sutures. So imagine you had gallbladder surgery and everything is great. The surgeons cannot go back in and remove the stitches because you're all closed up 2 weeks after. Okay. So those stitches absorb or resorb. So your body absorbs them and eliminates them naturally. So these threads dissolve after 6 to 8 months.
Okay.
So there's nothing left over after 1 year in the face.
Okay.
It's the fibrotic tissue that we spoke about that's holding and pulling.
That remains.
Yes.
Okay.
So threads are just sutures, surgical sutures with a little hook on them that allows you to pull and grip the tissue.
And they create the foundation for the building.
And
then
they create the
disappear.
foundation for the tissue to form fibrotic tissue to pull and hold. So I used to say it creates scar tissue to pull, but scar tissue sounds so fierce. It's really fibrotic tissue. It's this healing tissue on collagen.
All right, let's do it.
That's right. Let's do it. And so we have almost completion of the threads. It is amazing. I really, really like what I see. Now it's time for the adjustment. I'll take the mirror from my physician assistant and just hold and tell me now. So I know you like what you see because there's a big difference. There's a huge difference. Right now you have 0 jowls, 0 jowls, no jowls. Your jawline is nice and straight, jawline is nice and straight. Now from this point, we can take a little bit of filler and kind of really accentuate that jawline. I'm not going to do it today, but we can do that if necessary to create a look that Melissa wants. So now I need to find out, I know what Melissa really wants. So Melissa, I'm going to make a little adjustment in the thread itself. And you tell me here and there. Okay, how is that?
Which one? Like
this one here, where I made this one a little tighter.
They're both good.
It looks really good, right? So you can't really tell the difference.
No.
If that's the case, then we're done. This adjustment is perfect, and I'll be back in 1 minute.
Okay. So what is the sensation I should be feeling now, and for how long?
So now you should feel some numbness on both sides.
Okay.
It should feel a little tight. Try to open your mouth. Do you feel that tightness?
Yes, I do feel tightness.
So that tightness is going to make you feel as though you cannot eat or shouldn't eat, but you definitely can. It's just a different feeling that you have because everything here is tighter.
Okay.
And your body isn't used to that yet.
How long should I expect to feel that? 2 weeks, 3 weeks?
So you will expect to feel that in a couple of days. 1 to 2 days, you shouldn't feel that anymore.
Okay.
Now you're going to feel some discomfort here and here by the temples because that is where I lock my threads. So the reason I lock is so that the thread doesn't come down, which means that 1 year out, close to 2 years out, you should still have the same result.
Does that cause like headaches or anything like that?
Some patients can always get headaches from any procedure. Because I work in this region, you may get a headache. I think half the patients get slight headache. No one gets a severe headache. So patients don't typically get severe headaches, but it can happen. You had a procedure done, lidocaine was used, even if it was a very simple non-surgical procedure on my part, there's still some tiny amount of trauma that you have, but you can have a little bit of headaches.
And the swelling, there's swelling to come?
There's very little to no swelling, but there is some. Even though you don't see it, there is some swelling whether you see it or not. And that's what I need to resolve for at least 2 weeks before I see you again. After 2 weeks, then I'll see you 3 months later. So at the 3-month mark is when these results should be pretty much plateaued and be 100% finished. Then it should take another 3 to 6 months for that fibrotic tissue to really secure the tissue and for the skin to heal a lot tighter. So threads work not only on repositioning the fat up, but it also helps in creating that tightness on the skin.
So you get a little bit of it will ease a little bit as well.
Absolutely.
The tightness.
But we don't want the tightness to ease too much. You will get used to it and it will not feel as though you're tight at all.
I do love the instant results, I will say that. What is off dietary and physically? I do know that you are very strong about sleeping on your back, right? Like with everything, you prefer us to sleep, your patients to sleep on their back. So what is the aftercare? Do I have to clean? Do I
So everything that's necessary, I have done already. So with that, that means that you don't have to do anything. I prefer you do nothing. The only thing I don't want you to do is to apply pressure to this area.
So that means no facials, no
facials, no ice, no ice, no sleeping on the face, or no sleeping on the side of the face.
How about scrub in the shower?
Washing the face, you can wash your face as normal, but remember you had 2 little needles here and here, and so be gentle there for the next couple of days. And they're just needles, so nothing was open. It was just needles. So you're fine. You're already closed, actually. But still be careful of it because we did something there. Lotion, creams, your skincare regimen can be the same. Nothing changes. The only enemy here is pressure. And pressure comes from sleeping on the face. The weight of the head is about 13 to 15 pounds.
How about working out?
Working out, you can do everything as long as you don't work out on your face.
Meaning you can pick a child up.
You can pick a child up. You can carry things. You can do everything you were doing before. The only enemy here is pressure. Meaning any pressure touching the face, that's the only enemy here, because we don't want to pull the tissue back off of the thread.
It seems like you want that for a long period of time to avoid as much pressure on your face.
Always.
So
one of my mantras is don't sleep on the face, don't sleep on the face, don't sleep on the face. We create lines and creases in our face by our daily habits. And one of the major daily habits that we do that creates these lines is to sleep on the face. So you get the vertical lines on the forehead, some of the crow's feet, cheek lines, laugh lines. A lot of this is accentuated by sleeping on the face. When you're sleeping on the face, that's 6 to 8 hours of pressure on your face. So if I told you I'll come to your workplace and every hour on your lunchtime I'm going to do this,
let's not do
you
that.
would say, no, it's crazy, don't do that. But this is what you do. This is what you do when you sleep on the face. You're pulling the skin down. So you're stretching your own skin and creating these laxity in the skin and the lines and creases and everything. So don't sleep on the face. What are you not supposed to do?
Not sleep on your face.
There you go.
Okay. Drink water.
Yeah.
Alcohol?
Water. Alcohol, 24 to 48 hours, no alcohol.
Okay.
Anything that can reduce your healing time. Smoking is a big no-no, whether it's vape or tobacco. Dietary, you should always eat healthy, and hopefully as you love the way you look in the mirror, you'll also treat your body the same, and so your dietary habits would change to incorporate your new look. So you want to feel good inside as well.
Hands off face as well.
Hands off face, no touching the face. Absolutely. In general, it was the pain. How was the pain? Was there?
I didn't feel anything. I do know that things were happening because he has a wonderful team and staff, and you can feel that things were happening, which is great because that's why I have results.
Yeah.
I did not feel a thing.
Very good. So
I didn't feel a thing.
So I'm not finished yet.
Okay.
But as soon as I'm finished in the next 2 minutes, we'll have some before and afters. The immediate before and after.
Okay.